3 doctors there working with her, countless nurses, and Dr. Rachel Gill was leading the team. She started the process to save Gay's life. It was Saturday the 15th, I think, of March. I went down to let the working dogs out for their run. I came around from behind the shed with the dogs. I looked up here and I seen Gay flat on her face on the concrete with the car door open. She was conscious and able to talk, and she told me that she had a massive pain in the middle of her chest. Her glasses had broken and one of the legs of the glass was protruding in above her eyebrow into her head. I put her in the car and headed straight for Maxwell Hospital.
I was driving in the street and it was probably about 4:45 and I passed Dad and he was driving a bit quicker than usual, and I stopped in the street and Dad stopped and he reversed up to me and he wound his window down and I could hear Mum groaning. She was in pain and he said, "Shell, call the hospital. Mum's fallen. She's got chest pains." And I said, "Okay, go, just take her." I remember ringing the emergency department and letting them know that Dad was bringing Mum in.
We got to Maxwell Hospital. Gay was still in massive amount of pain. The triage nurse come out and helped me get her into a wheelchair and they took her straight in. After 10 or 15 minutes, they come and got me and brought me in to sit with Gay. There was 3 doctors there working with her, countless nurses, and Dr. Rachel Gill was leading the team, and she started the process to save Gay's life.
I was notified by the nursing staff who had met Gay in triage that she was obviously very unwell, and so the staff made a decision to bring her straight into a bed so that we could start to assess her. The nursing staff were so responsive, immediately getting her onto appropriate monitoring, getting her IV access and doing all the things that we would do under a protocol for assessing an acute chest pain patient. It became a concern of mine that actually this heart attack might not be the most common presentation of heart attack, which is usually a blocked blood vessel supplying the heart, and that actually this presentation might be a dissection. This is a more rare cause of heart attacks, but it's certainly something that we think about when we're considering why somebody collapses.
I sat with Gay for probably 10-15 minutes and then I had to move out of the road because some more alarms were going off on the machines.
We actually then had a deterioration in Gay's presentation. The patient had developed what we call a pericardial effusion, where there's actually fluid around the heart from the tear in the aorta, and that fluid is blood that's building up, and that starts to compress the heart over time. This is an extremely precarious situation with a very high chance of a patient not surviving. And what a patient needs at this point in time is a cardiothoracic surgeon, which we don't have at Maxwell.
After probably another hour, they told me that had Gay, they thought, stable enough to move to Coffs. Emergency ambulance arrived. The 2 paramedics came in and prepared Gay to be moved. They asked me best thing to do was to go home, get cleaned up and get someone to drive me up to Coffs Harbour Hospital.
We travelled through with Gay in the back of the ambulance with an excellent and very supportive ambulance team. She sort of held through that journey.
We got to Coffs Harbour Hospital roughly 7 o'clock on the Saturday night, and we couldn't get in to see Gay, and we'd found out that she'd actually passed away and they'd brought her back to life twice.
Probably about half an hour and we got let in, and the first person I noticed was Rachel the doctor, Rachel Gill. I looked up a few times and watched Rachel, and she was amazing how composed she was.
The CT scan confirmed our suspicion of the tear to the aorta, and it was an extremely extensive tear. It had compromised her whole aorta.
The way she commanded everyone to do things was amazing. I've never seen no one work like that under such a difficult situation.
Given she'd been able to be maintained at a certain degree of stability up until this point in time, that we would proceed with the transfer. And that's a very long wait. You've got an extremely unstable patient. She was still needing to be actively ventilated. She's on a number of medications. Blood pressure was very unstable.
For the next so many hours until like 1:30, 2 o'clock in the morning, I just watched her, and she never took her eyes off them monitors. And she pretty much was calling more of this, more of that, more of this, and I believe she kept Mum alive.
The helicopter arrived about 1 o'clock in the morning. They came in, they prepared her to go. And the doctor off the helicopter called me aside and it was very polite, but told me that basically Gay's only chance was to get to John Hunter Hospital, but he had 99% sure that she wouldn't make it because she was in such a critical condition. When they told us we could go back into the room and see Gay, I walked in. Mum, as everyone calls her, was sitting up in the bed and able to speak. I just couldn't believe it. It was like a dream. I cried. Rochelle cried. Mum went crooked as I cried. And it was just hard to believe that from where she'd been 8 days earlier and nobody gave her a chance of surviving, that she had the inner strength to will herself to be able to get better, with a lot of help from a lot of unbelievably skilled people.
So one of the reasons that patients like Gay are able to have such an impressive outcome, despite all of the odds of tyranny of distance as well as the severity of their pathology, is the investment we've had in the people. We have senior clinicians, staff specialists, emergency physicians and VMOs working across the smaller sites. And what we're able to do is bring a high quality of knowledge and education and then translate that right throughout the team.
Greg and I cannot fault either hospital, John Hunter, Coffs or Maxwell, for the care that I was given, because by rights I shouldn't be here, except for their good care I am.
That's one of the things that gives us a lot of joy as clinicians, is seeing people come out and be able to be a very active part of their family and their lives.
Rachel is absolutely amazing. She went far and beyond. Like, she didn't have to go in the ambulance to Coffs to make sure that I stayed alive. Thank you very much for saving my life. Yep, she sure did.